Welcome to this virtual press conference on COVID-19 with WHO in the Western Pacific region. My name's Olivia Law-Davies. I'm the Regional Communications Manager here in the Western Pacific region for WHO, and I'm delighted to be joined today by Dr. Takeshi Kasai, WHO Regional Director for the Western Pacific, Dr. Socorro Escalante, the COVID-19 Incident Manager, and Matthew Griffith, Technical Advisor with the COVID-19 response in the region. Thank you very much to all the journalists who have joined us online. We're going to begin with a few remarks by Dr. Kasai. Thanks.
Thank you very much. Today marks 3 months since WHO was alerted to a cluster of pneumonia cases of unknown cause in Wuhan, China. Since then, the world as we know it has changed swiftly and dramatically, affecting millions of people's lives. I am so saddened by the fact that more than 33,000 people around the world have lost their lives to COVID-19 in the past 3 months. And I would like to express my deepest sympathy to those who have lost loved ones. The Western Pacific region was hit hard by SARS in 2003. We have been preparing for an event like this ever since. But this is a pandemic, unlike the world has ever seen, and it has changed our system and put a strain on people's lives in an unprecedented way. This special situation was met with the special measures over the past 3 months to protect the population. Fortunately, with the exception of the initial situation in Hubei province, China, this region has not yet seen large-scale community transmissions of COVID-19. Rather, in recent days, eyes has been fixed on the rapid spread of the virus in the Western Europe and North America, which are now seen as the new epicenter of the pandemic. But let me be clear, the epidemic is far from over in Asia and the Pacific. This is going to be a long-term battle, and we cannot let down our guard. We need every country to keep responding according to their local situation, and at the same time, we need every country to keep preparing for large-scale community transmission. And if we want every country to prepare and respond, we need to do it together. I'll now ask to Dr. Matthew Griffith to give a snapshot of the current situations in the WHO Western Pacific region.
Thank you, Dr. Kasai. Thank you to those who are online. Can I have my slides, please? As we get those slides up, maybe I will just begin. As of today, more than 720,000 cases have been reported from 202 countries, with more than 33,000 deaths. And this is increasing. For the first 2 months of this outbreak, COVID-19 was almost exclusively reported from this region. The focus has now shifted to Europe, where more than 30,000 cases are being reported daily, and it will likely soon shift to other regions. Nevertheless, we cannot forget that COVID-19 continues to circulate here in the region. Can I get the next slide, please? Thank you. So, as I was saying, for the first 2 months of this outbreak, COVID-19 was almost exclusively reported from this region. The focus has now shifted to Europe and will likely soon shift to other regions. But we cannot forget that COVID-19 continues to circulate here in this region. In the past 2 weeks, we've seen 5 countries report their first case and 4 countries report their first death. Next slide. As epidemiologists, we think about this disease in stages because it helps to orient our response. So these recent countries reporting their first cases would be in the first stage on the left. In that stage, we have a small number of persons with the virus, and they are linked to travel or to people who have traveled. Very soon, however, countries and areas began to see people with the virus who could not be linked to travel. So we see local transmission, and that's the middle stage here. Finally, we have this stage on the right of large-scale community transmission. That is when it is difficult to make clusters and link people. Transmission is common. Next slide. In this region, we have had the misfortune, but also the benefit of being first. Only 6 weeks ago, 99% of cases were reported from China, especially Hubei. China was reporting as many as 3,800 cases in a single day. Around that time, other areas with substantial links to Hubei and to China began to report cases, especially Singapore, Japan, Republic of Korea, Malaysia, and Hong Kong SAR, China. We then saw a large outbreak in Daegu, which is this yellow-orange area, mostly the yellow-orange area on this slide. The decrease that we saw both in China and in the Republic of Korea, and then the low, stable trends from Singapore and Japan are encouraging. And this is the benefit of being first. Countries and areas in the Western Pacific region were on the leading edge of responding to COVID-19. Nevertheless, we are now seeing increases in cases reported in Australia, Malaysia, and the Philippines, among others. What this means is that even though some areas get past the peak, outbreaks will continue to occur in other areas. This is the characteristic of a pandemic. Next slide. So getting back to being on the leading edge of this outbreak, I'd like to point out this slide, which shows the rate at which cases are reported. The lines that go up represent a rapid increase in cases, which is shown by the dotted line indicating that the number of cases double every 3 days. The lines that go out to the right represent a slower rate of reporting, also shown in the dotted line with a doubling time of 10 days. So it is easier on a healthcare system and on the population if the line is more horizontal. Of course, we are well aware how China had a difficult time in the beginning and then was able to flatten that curve. The Republic of Korea also had a large cluster in one area and was able to flatten the curve. Then we have Singapore, Hong Kong SAR, China, and Japan that have been able to maintain manageable rates of reporting. So from this graph, we can see that there is something different happening in this region. We need to study this to find out what made these countries different. They were the first to demonstrate how to slow the spread of the virus, and the global community can learn from that experience. Next slide. This experience is also needed here in our region, especially now that new countries and areas are reporting. In our region, most recently, that means Laos, PDR, Papua New Guinea, Fiji, and the Commonwealth of Northern Mariana Islands. I say this to emphasize that the risk of epidemic remains high in all countries and areas. Next slide. New countries and areas are not the only risk. Areas that through strong efforts to contain clusters and promote physical distancing were able to slow the rate of infection, like Japan, like Singapore, like the Republic of Korea, are now reporting increasing cases again. And that's represented in this slide of Singapore. Most of these increases are imported cases. This is also a concern. So whereas countries and areas in this region have shown how to flatten the curve, outbreaks continue to pop up in new places, and importation remains a concern. Next slide. This is particularly concerning because some areas in our region may not be able to do what China and Republic of Korea, Singapore, and Japan have done. Thank you.
Thank you very much, Matt. Thank you very much, Matt. We are very much encouraged by the countries in the region that have pushed back the virus or managed to slow their epidemics. We recognize that there is no one-size-fits-all approach to preparing for and responding to an emergency like this. But we have found common tactics in these countries. Those are finding, isolating, and testing case early, tracing and quarantining contacts quickly, and putting in place multiple public health interventions to increase physical distance between people to slow and stop transmissions, and mobilizing and engaging every community to protect themselves and the most vulnerable. But we need to be clear that even with all of these measures, the risk will not go away as long as the pandemic continues. Rather, these measures can buy us valuable time to prepare for large-scale community transmission. And we also have to find a way to make our societies get running again. Preparing for large-scale community transmission must reach every corner and community of every country to make sure that nobody is left behind. For this, we need all local authorities and communities to be fully engaged. Here at WHO, we are especially focused on helping resources-limited countries with fragile health systems. We provided a range of support, including the procurement and delivery of personal protective equipment and diagnostic tests to these countries. We are also have to make sure there is a minimum disruptions to routine health services, such as immunization for children and tuberculosis treatment in those resource-limited countries. But what we think is most important is individual mindset and practice to protect the vulnerable. Those who are most susceptible are the elderly, people with pre-existing conditions, and also our healthcare workers. Healthcare workers are the group that most exposed to the virus than anyone else, and they are critical to the response. Before we take your questions, I'd like to relay a few important messages. For countries that are seeing case taper off, this is not time to let down your guard. If we do, the virus will come surging back. You must keep up your effort and help other countries in whatever ways you can. For those seeing their first case or managing new spikes in cases, stay strong and stick with the tactics that work and know that flattening the curves is within reach. For young people, please know that low risk does not mean no risk. Young, previously healthy people are among those with the COVID-19 in hospitals right now. And if you don't take precautions, you're not only putting your own health at risk, but the health of those around you. And to all people across the region, please support effort to fight COVID-19 and take actions to protect your family, colleagues, community, and vulnerable. We're now ready to take questions, and over to Lee for instructions. Thank you very much.
Thank you so much, Dr. Kasai. And thanks to all the journalists who are online and who have sent us questions from all over the region and beyond. Please remember that if you're connected to this video conference on Zoom, you can type in your question using the chat function, and remember to include your name and your outlet. We're going to try to get to as many of our questions that we are receiving as we can today. We're receiving quite a lot. A number of you are asking variations on the same question, so we're going to try to combine some of them and start with those. Also, several have sent in 3 or 4 questions, so you'll have to forgive us, but we might not be able to get to them all within this first video press conference, but we'll be sure to get back to you. In the interest of time, I'm going to now start with some of the questions. The first one we've received from several different outlets, including the Pacific Media Network, GMA News, and Nova TV. It's about the status of vaccines and treatments for COVID-19. Dr. Kasai, would you like to give us an update?
Thank you. As of today, there's no specific treatment or vaccine for COVID-19. But researchers and institutions, both public and private around the world, is working so hard to develop those tools. There are, as of today, more than 50 candidate vaccines and several clinical trials for treatments ongoing. And some of those prototype vaccines even moving into the human trial. This is a remarkable speed, and I hope that the vaccine development will be as much fast as we want, but it will still take some more time. For the treatment side, there are several drugs trials ongoing. WHO offered two platforms. One is called R&D Blueprint, which we developed after the Ebola, and recently also introduced a solidarity trial, which tries to bring multiple countries following the same protocol so that we can work together and produce the output that we can analyze effectively so that we can identify an effective drug as quick as possible.
Thanks, Dr. Kasai. Next, we have a question from NHK, and it's a two-part question. The first part, in the Philippines and Indonesia, the number of deaths is increasing compared with other Asian countries. What's the reason for this? And the second part of the question, will a lack of ventilators be a problem in this region as it has been in some other countries? Matt, can you respond to this one?
Sure, thanks, Liv. I just want to make clear, we're talking about two different questions, right? So one is about the deaths in the Philippines and one is about ventilators. Is that right? Okay, so I think first for the number of deaths in the Philippines. So number of deaths anywhere is a concern for us. I think many people are seeing the proportion of fatal cases or the case fatality rate in the Philippines is quite high. But that's because the Philippines has taken a testing strategy where they're prioritizing severe cases. So that means your denominator is going to be restricted to people who have more severe disease. People with more severe disease are more likely to die than people with more mild disease. So that proportion goes up. Philippines has recently put online or has trained and is building the capacity 5 sub-national laboratories. And so we expect testing to increase substantially in the coming days. So I think that's one thing with respect to the high proportion of deaths in the Philippines, that it's essentially because of the way Philippines has chose to test. And this testing strategy is very much influenced by global shortage of laboratory reagents, laboratory supplies, which is also related to restricted travel and trade that's happening in many areas. The second question that you're asking is about ventilators. So that's also a concern, not only in the Philippines, but everywhere. As we have a shortage of PPE, we also have shortage of laboratory reagents and shortages of ventilators. The demand for these is increasing, and the supply is not increasing at the same rate. Additionally, we have logistical challenges in place for moving these kinds of equipments due to a lot of the travel restrictions that are being put in place. With respect to the deaths in the Philippines, getting back to that question, what we know is that it was not related to a lack of ventilators in the Philippines. So I think it's clear to make sure that those are different issues that we're dealing with.
Thanks, Matt. We have a question now about testing from GMA. They said that there are challenges to testing here in the Philippines due to limited test kits, laboratory facilities and personnel. What's WHO's advice to countries with this situation? And what's WHO's stand on rapid testing and point-of-care test kits? Dr. Kasai, can I throw to you for the first question, please?
Thank you. So rapid test kit, I will leave it to Sok for answering. This is the challenge not only for the Philippines. Even the developed countries does not have a sufficient test to test everybody. So it is very important to have a testing strategy to prioritize who to test. And from clinical perspective, obviously those who have severe symptoms or the people who is elderly with the underlying conditions. But what is important from the public health perspective is that the test would be effectively used to identify the case early, isolate and treat, but on top of that, to trace the contact and then quarantine.
Thanks, Dr. Kasai. On rapid testing, Dr. Sok, can I ask you to add a few words?
Thank you so much, Liv. We are aware that there have been a number of rapid testing kits that have been introduced in the market. However, these rapid tests are still being evaluated, and we have not seen the evidence and the potential performance of these tests to diagnose COVID-19. However, research is ongoing, and we will continue to look at those information as they come on.
Thanks, Sok. And one more from GMA. What is your comment regarding the medications chloroquine and azithromycin as treatments for COVID-19? Another one for you, Sok.
Thank you so much, Liv. Chloroquine is an anti-malarial drug, and azithromycin is an antibiotic. We are aware that there have been some studies in vitro that is undertaken in the laboratory that may have shown the effectiveness of chloroquine against the virus. However, there has not been any trial, random controlled trial that has been undertaken to show the effectiveness and the safety of these medications. Recently, WHO, as has already mentioned by our regional director, has launched what we call the Solidarity Trial that is going to test the safety and effectiveness of several potential medicines across different countries. This includes the usual care that is provided to the patients in their respective countries. Another drug that is going to be included is remdesivir. This is originally a drug that was under research for the treatment of other coronaviruses. We have also the lopinavir and the ritonavir. This is the existing anti-HIV and AIDS drug. Another combination is lopinavir, ritonavir, and interferon. And also, finally, as I have mentioned, chloroquine. So these studies is going to be undertaken in the next few months, and WHO is encouraging countries to participate. And as far as the Western Pacific region is concerned, we have already 3 countries, including the Philippines, Mongolia, and Malaysia, which have put their interest to participate in these studies.
Thanks, Sok. We have a question from The Standard of Hong Kong and also a similar one from Reuters regarding the reliability of data coming out of China. China reports that they've almost eliminated local transmission of COVID-19. So the question is around robust testing to detect cases. Is that still happening in Wuhan and Hubei and the rest of China? And is China reporting reliably and credibly to WHO? Dr. Kasai.
Thank you, Liv. China continues to be vigilant. They monitor the pneumonia in the healthcare facilities. They monitor the fever clinic. They're also using so-called influenza-like surveillance system to monitor the situations. And they also monitor those who are coming back from outside the countries. And they're reporting to WHO regularly. And so they haven't really relaxed, but I think they're even more strengthened their monitoring system. But as many other countries, if the people who infected doesn't show the symptoms that requires for going to the healthcare facility, it's very difficult to catch those people. As a pandemic goes around, I think it's very important to continue to be vigilant.
Thank you, Dr. Kasai. Another question from The Standard. Which countries or areas could serve as a model for showing leadership, clear strategies, and risk communication in handling their outbreaks within our region? Singapore, Taiwan, and Hong Kong are often named. Dr. Kasai.
Every country is trying their best with their own context. And what we have observed is actually there's no one size fits all. And in fact, that what we learned from China is that every province is adjusting their approach tailored to their own context. But at the same time, we found that the common tactics within those countries who successfully slowing down the spread of the virus, which I have mentioned in my intro, those are identifying the case, isolate, and then treat early, and trace and quarantine those contacts, and introduce multiple public health interventions to have a distance among the people, and then, of course, engaging the community. But I wanted to a little bit highlight there are countries based on their SARS experience, really bringing their lessons learned and then making the systems working, such as Singapore. They have a multi-layer surveillance systems to monitor those infections in the community. And they have a system to identify those cases quickly. And then they have a very good communications to make entire Singapore people to participate to this fight. Taiwan, China, or Hong Kong, they are also the one that showing a very robust response to this COVID-19.
Thanks, Dr. Kasai. We have questions from ABC Radio Australia and also the Pacific Media Network about the South Pacific. How resilient is the Pacific to fighting the spread of COVID-19? Can we outline contingencies that WHO has to help the Pacific deal with it? Some of the countries in the South Pacific are still virus-free, and are they doing enough to keep it that way? Dr. Kasai?
Thank you very much. As I mentioned, that a country with the limited the resources with the fragile health system is a priority. And Pacific Island countries is definitely our priorities, and we're worried. For example, when they wanted to diagnose COVID-19, unlike other countries, they have to ship their samples to outside their countries, and that takes easily 10 to 2 weeks. And now, because of there's no availability of flight, it's no longer possible to even do that. But recently, there's a new diagnostic tool called Gene Expert, which Pacific countries also have the infrastructure. So we really wanted the international community solidarity to prioritize those diagnostic kits to be prioritized to the Pacific Island countries. And we wanted to do our best to make that happen. So we're obviously worried, but we also noted that the Pacific has a very important resources called a community. They have a very strong community. And then we've been observing the power of the community whenever they have unfortunately hit by the natural disaster. We're connecting all the Pacific countries once a week and discussing how to prepare, how to respond to situations. And I'm very much impressed that the many Pacific countries are actually engaging a traditional leader, community leaders, women's clubs, or the NGOs to engage the community and be ready. Of course, we continue to be concerned, and they have putting a very strong measure called border closing, but I think we cannot continue this forever. So we have to continue to work all these Pacific Island countries to be also ready for their domestic response.
Thank you, Dr. Kasai. The next question that we have is from Sky News. There have been reports in some media that there might be 2 strains of COVID-19, an Asian strain and a more aggressive Italian strain. Is this factual? And a related question from Agence Presse Pacifique. Can we expect a mutation of the virus linked to the tropical climate and the specificities of Pacific Islanders? Dr. Sok, could you respond to these?
Thank you so much, Liv. So there has been a lot of research that is being undertaken to understand this virus, but so far we have not seen any evidence that shows that there are different strains of the virus that is causing the disease. On the second question on whether or not the tropical climate is going to affect the mutation of the virus, again, we could not say that because the mutation of the virus may not necessarily be affected by any weather or temperature conditions. So again, our answer to that question is that we will continue to observe the information that is provided by the scientists and experts that are undertaking various research around the world.
Thanks, Sok. A question now from the Mongolian national broadcaster. Will COVID-19 continue into the summer and autumn? When can we expect it to end? Basically, what do we know so far about this virus with regard to its spreading in warmer temperatures? Dr. Kasai.
I understand that there are some experts or the people talking that this virus would disappear when the temperatures goes up. But unfortunately, we don't have any evidence to show or prove that kind of theory at the moment.
Okay. A question now from the Philippine Daily Inquirer. The Philippines is midway through its lockdown of Luzon. Should borders be reopened on April 12? And what is WHO's advice to authorities to prevent seeing a wave of new cases? Dr. Kasai, could you speak to these questions as well?
It's about lockdown.
Yes.
Lockdown is the measure. Obviously, it has a significant impact to the economy and the society and functions of the social life. So it is the means that requires careful considerations when we decide to implement. At the moment, myself is in the middle of lockdown in Manila, and I'm very impressed by the Filipinos people's solidarity and try to cope, and then they support this lockdown in Philippines. But I observe not only Philippines, many other parts of the world, there are such a solidarity in supporting this effort. To make this lockdown effective, not just the individual and community support, obviously government has to ensure the basic lifelines will maintain. So if you don't have those kind of structures, it's very difficult to make those measures. And lockdown, to be effective, we have to also continue find a case, isolate and treat early, and also trace and quarantine those contacts. And lockdown is a bundle of public health measures. And obviously, as I mentioned, that these measures cannot continue forever. So at some point, as questioners ask, the government needs to think when to lift these measures. When you do that, again, we have to make a careful considerations of the epidemiological situations and the impact of those lockdowns. And we may have to peel one by one, not just immediately lift, but those public health measures, which was is bundled at the lockdown, to balance the control diseases and to bring back the societies back to normal.
Thanks, Dr. Kasai. We have a question from China Press in Malaysia about Ramadan, which will soon begin. What preventive measures should be taken by Muslim countries amid the COVID-19 pandemic? Matt, would you like to respond to this one?
Sure, Liv. Mass gatherings in general have shown to be a place where coronavirus spreads. Not all mass gatherings, but definitely some mass gatherings. So we've seen a very large cluster coming out of Republic of Korea that was associated with a religious-based mass gathering. We've seen a very large cluster coming out of Malaysia that was also associated with a religious gathering, a mass gathering. But we've also seen clusters come out of smaller mass gatherings. So I think that whether they are religious in nature or not, the point is to take a risk-based approach to mass gatherings. Often in these very large mass gatherings with thousands of people, it's hard to maintain social distancing. So even here in our room right now, we're having a gathering, but we're maintaining a distance, and that's really fundamental for preventing the spread of this virus. So our recommendation for governments, for event holders, is to assess the risk of these events. And that goes for religious events, non-religious events, anything where you're going to have a large amount of people coming together. We need to see how close they're going to be together. We need to see what measures are put in place to prevent the spread of the virus, either through direct contact or through droplet transfer. We need to see how long people are going to be together. And if we can look at that in a reasonable way and assess the risk for these types of events, then people can make decisions about whether those events should go forward or not. And if they go forward, what sort of measures need to be put in place to reduce the risk of getting infected and reduce the risk of spreading that infection to other areas.
Thanks, Matt. We have questions from DevX. Rumors and misinformation continue to circulate in countries, but are there particular rumors or pieces of misinformation that have been persistently shared in the region that are of a concern to WHO, and how are we trying to correct those? Dr. Kasai.
That's a question to me, not you. This is actually the first experience for me to have to fight not just only with the diseases itself, but also to fight with the rumors. There are multiple rumors that spread even faster than the virus spread. And WHO is putting our best effort, putting a website such as a Mythbusters website to provide the right information to the people. But we're also having a partnership with the private sectors to make sure that people can have access to the right information. I cannot really answer which specific, the rumors are the most, the popular ones. But what I wanted to encourage people is to really access the right information and understand the risk and know how to protect yourself, but also your family and community and the vulnerable.
Thanks, Dr. Kasai. We have a couple of questions from Nikkei. Which areas of Asia are expected to have the highest spike in cases? And are there particular parts of the region that we're most concerned about handling this spike? I'm going to start with giving that to Matt.
Thanks, Liv. So even though we've been at this for 100 days, this is still a new virus for us, and we're learning something new every day. I think it's really difficult to pick individual countries and areas and predict which of those areas are going to spike. If we could do that, we would all be much safer, but we can't. So what we know from the science right now is that, as I was mentioning earlier, gatherings seem to be a place where the virus is very efficient at transmitting. We know that the transmission is mostly through droplet spread, through direct contact or through indirect contact with droplets. So if we start to think about the risk of that, we can try to understand what measures need to be put in place ahead of time. And if we are using a risk-based approach towards mass gatherings, towards other social interventions or non-pharmaceutical interventions, physical distancing, instead of trying to figure out where the disease is going to happen, we can take an approach to try to prevent the disease from coming or spreading in areas that are more vulnerable. And I think for us, it's more a question of which areas are most vulnerable because of fragile healthcare capacity, because of a low socioeconomic profile or composition of the country. So these are the ways that we're prioritizing countries. We do not expect that any country is going to be safe from this virus. So we are expecting that eventually it will get to everywhere, and people need to take measures to prepare for that.
Thanks, Matt. We have a question from RNZ Pacific and also a similar one from ABC Australia. When are the isolated countries in the Pacific likely to get in-country, on-island testing capability? I'm going to ask Dr. Kasai to start with a response to that, and perhaps it can be complemented with other comments afterwards.
Liv, can I add a few comments to the previous questions? In our region, there are countries who successfully push back once, and there are countries really suppressing the virus spread. For those countries, I really want them not to really put the arms guard down. We need to continue to be vigilant and be ready to respond. And there are countries who is now experiencing a quite quick increase of the number of the cases. We wanted these countries to do what we have shared, proven tactics to bring this virus increase lower. It's much better to be overstretched now and then to engage the entire community support to suppress now than moving into the large-scale community outbreak. And we really have to put our effort in doing that. But the time we're buying, we need to also prepare for the large-scale community outbreak. And also, we may have to also consider, because we cannot continue this effort as a forever. So we have to find a approach, that the balanced approach that we can also make our societies run. So this is my additional comment to the previous questions. And back to the questions of the Pacific. We wanted to make sure that all the Pacific who has those infrastructures of the diagnosis, which I have mentioned, called Gene Expert, to receive this cassette so that they can make a diagnosis in their own country. But again, this test itself will not be enough to test everybody who you suspect. And then we need a testing strategy tailored to their context. One from the clinical perspective to prioritize who to be tested, but also to use this diagnosis effectively in the public health interventions.
Thanks, Dr. Kasai. We also have a question from Nikkei about the current situation in terms of clinical trials of Avigan. How promising is it? Dr. Escalante.
Thank you so much. We are aware that this medicine Avigan is being under clinical trial in China, and we are looking forward to the results as well. We could not comment on whether or not this medicine is promising or not. I guess we need to wait on the results of the clinical trial.
Thanks, Dr. Escalante. And now we're more than 45 minutes into the press conference, so I'm just going to pose the last question for today. The one that I'm going to ask is from Vera Files in the Philippines. Can we already draw a time frame for how long this pandemic will last, given our present data? Dr. Kasai?
I understand that people's worry as this is a new virus. We still don't know how long this COVID-19 fight will continue. There are people around the world, 24 hours, 7 days, they're doing their best to fight with this COVID-19. But it's unlikely that this virus will disappear next week or even next month. And I'm now using this opportunity to sending a message that this battle is going to be a long-term battle. And we wanted every country to respond according to their epidemiological situations, but prepare also for the large-scale community outbreak. And buying time with suppressing the virus spread, we also wanted to think the strategy to bring back, in a balanced way, the societies back to normal as much as possible. And what is important is that we wanted everybody's help to protect yourself, but protect your family, colleagues, community, and the vulnerable.
Thanks, Dr. Kasai, and thank you so much to everybody who's joined us online today for this virtual press conference. I'm afraid it wasn't possible to get to every single question that we received, but please know that we will be following up with you. If we didn't get to it today, we'd be happy to come back to you afterwards. Thank you so much, and we look forward to doing this again soon. Thanks.